Hi everybody, it's Mary Fete, and we're just going to wait a few seconds to get started because actually I'm waiting for Jody to text me to tell me I'm really on, because last time when I wanted to open up Awareness Month, I spoke for like about 5 or 10 minutes and realized I really wasn't on Facebook Live after all. So I've learned some valuable lessons, so I'm just waiting to make sure that I'm on. So I'm really happy that you could join me this evening, and we're just gonna spend a little bit of time chatting, and then we'll open things up for questions. Still waiting to hear from Jody, unless somebody can tell me I'm on. Give it a few minutes. It says I'm live. Yes, I'm on. Thanks, Becky. I don't know where Jody is, but this morning we practiced and she was about 10 seconds behind me. So anyway, welcome everybody. Thanks for joining me this evening. I really appreciate your time. I know you know me, I'm Mary Fete. I'm the Executive Director for the National Foundation for Ectodermal Dysplasias, and I'm here at my kitchen table doing Facebook Live with you. It's kind of ironic that I'm running the organization here from my kitchen table, but now that I think about it, it's really not. Mary Kay Richter, our founder, founded this whole organization right from her kitchen table, so it's kind of full circle. So I'm here, socially isolated with my hubby, Tim, Dr. Tim.
Hi.
And also, not to minimize our other good family member, our dog, Katie. Now she's not cooperating. I wanted to show you Katie. So there's Katie. And we're all socially isolated right here at home. Whoops, no, I don't want to end this video. Anyway, so these are really challenging times, right? I mean, we're all nervous, we're anxious, we're scared, we're not sure what's going on, and we have never been in this situation before. I know that most of you are working from home, if we're all fortunate enough to have our jobs still, and so we're working from home, and I want you to know that we are working from home. The NFED is still working. We're still here to support you. We want to hear from you. Kayla, she's not on, but Kayla's still answering the phone, and she's transferring calls or taking messages, and we will get back to you, hopefully within 24 hours. You can email us, you can call us. We're still here for you to support you and your families. So I know you're nervous right now. You're worried about your babies getting sick. You're worried about your families and your health. We're all worried financially. We're worried about our emotional health. We're all within the house, and we're not used to that. We're not a socially isolated people. So we're uneasy, and I understand that. I'm in the same boat. We're all in this together. So I thought it would be a really, really good time for us to just get together as a family and talk about a few things. So that's exactly what we're going to do tonight. Please feel free to type your questions in the chat box, and we'll answer them all at the end. Because quite frankly, we're not all that great at Facebook Live, so if the type answers and talk at the same time, I'm not sure how good that would go. So we really don't know how our community is going to be affected by the coronavirus. We don't know specifically what it means for the ectodermal dysplasia community. It's a new disease, and we're learning as we go. But just because we don't know everything we wish we knew, or that we will know, doesn't mean we don't know anything. There's some things that we do know. So we know from a study that we did that some of our community, specifically the HED community, some individuals may be at greater risk for respiratory illnesses and diseases. And you probably know if you're one of them or your family gets respiratory diseases more often. We do know that some of you have trouble with temperature regulation, right? You're worried that you'll have a high fever or your child will have a high fever, and because you don't sweat, that you won't be able to manage the temperature. But we know there's ways to manage temperature. We also know that some of our families have immune problems. Maybe their immune system is compromised. So, and you likely know that as well. So if you're in that group, or you have other health issues, you need to be super, 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 super diligent and follow the CDC recommendations. And quite frankly, we all need to be super, super, super diligent in following the CDC recommendations. Now, interestingly enough, I did get an email from one of our sister organizations from Germany today, where she talked about 2 individuals who were affected by X-linked HED, and they got the coronavirus. The first one was a woman in her 30s. She had flu-like symptoms. She had fever, cough, headache, GI symptoms, and she tested positive for the coronavirus, as did her husband. She managed her symptoms at home. She did not have to go to the hospital, and she's fully recovered, her husband too. There's also a case reported in Germany of a 50-year-old gentleman affected by X-linked HED, also testing positive for COVID-19. And he also managed his symptoms at home, did not need hospitalization, and he's fully recovered. The younger couple had children in the home, and they were not affected, and they did not get the coronavirus. So what does this tell us? Really not a lot. We can't make general assumptions about just 2 cases, but it does tell us something, right? It tells us that at least these 2 individuals that were affected actually did quite well and fully recovered. So I do think that tells us that individuals, we really don't know how this virus is going to affect anybody. They're still studying it. So, but that does give us something to hang our hat on. So I will tell you, we all need to be strictly following the CDC recommendations. The CDC website is your best source for information. So you need to be socially isolated, right? We're sitting in our house. We've been here for weeks. We'll probably be here for another couple months, but we're socially isolated. And we're not going out in the community. You need groceries. You go in, go out. You wipe all the surfaces, or you have. So you need to stay home. And what does socially isolated mean? Does it mean you can have a play date? Your kids can have a play date? No. Even with one child? No, because we don't know what families' social isolation policies are, even if they think they're being socially isolated. So as hard as that is for us, it's hard for me, it's hard for the kids, they don't get it. And so, but they need to be home. You need to be home with your immediate family, those family members you normally live with. Now, some of you have jobs that you probably have to go to, and you may have some necessity errand you have to run, in which case you need to be 10 feet away from your coworker, if at all possible. I know there's doctors and nurses out there, and that's a whole different set of problems. And I greatly admire all of you that are working to keep our community safe, taking care of the sick, the healthcare workers, the truck drivers that are delivering our food so they don't go hungry, the police officers, the firemen, and of course all you teachers that are teaching remotely. I thank all of you for this great service to our community. So no play dates, no nothing, socially isolated. We need to wash our hands a lot every time you pass the sink. And it's just not dry. It is a full 20 to 30 seconds of hand washing. Now, your kids probably know a song, wash, wash, wash your hands. I can't remember those lyrics, but I do. Row, row, row your boat gently down the stream. That whole thing. I do it twice, slowly. That way I know it's 20 seconds, because actually 20 seconds is longer than we think. So find some way that you know that you do it, wash your hands 20 to 30 seconds. These have now become our best friend, hand sanitizers. So I carry it with me. I use it a lot. So, and I know that some of you are prone to drier skin, so all this hand washing is probably taking a toll on your hands. And I know that we posted some information. Go out to our website, check it out, because you need to take care of your hands so they don't dry, crack, and bleed. So wash your hands, socially distance every day, either bleach solution or something. You're going to wipe down all your countertops and your doorknobs, because we can bring that virus in and it can live on the surface of your home countertops and doorknobs. So make sure you're doing that. When you sneeze or cough, it's into your shoulder, not your hand or a Kleenex, and don't touch your face. Now, every time somebody tells me not to touch my face starts itching, my nose starts itching, my eyes start itching, and so trying hard, don't touch your face. So it's me and Tim here, so we're not homeschooling any kids, but all our kids are homeschooling their kids, and I know a lot of you are doing that too. Kids are home from school. And you know what? Kids are scared, even if they don't act like it. They don't get it. How could they possibly get it? We don't get it. It's like we're living in a science fiction movie or some big bad dream. Never in our lifetime do we think anything like this would happen. So they're confused. They're home from school. You're teaching them. They're zooming in with their teachers. They're scared and nervous too. So they may not let on to be nervous, but you have to talk to your kids about it so that they understand. And that is exactly why I roped Dr. Tim, my husband, into being on this call with me, because he's going to give you some great pointers on how to talk to your kids and a few things about kids that you need to know. So let me introduce Dr. Tim Fete. He is a pediatrician. He's been on our scientific advisory council for, 30 years. He retired last year. He was the chair of pediatrics for the University of Missouri Child Health System. So he's going to talk to you a little bit. So we're going to switch chairs, and a little bit about what you should say to your kids.
Hey, good evening. Of course, Mary's an incredibly talented nurse, so she's already told you everything that I would have told you, and I have very little to add. But I will talk a little bit about kids, and probably the most important thing that I'm going to tell you tonight is about a website from the American Academy of Pediatrics. It's healthychildren.org, and it's amazing. I have it drawn up. In fact, I'm playing with my computer off on the side here.
Jody, can you type that in, or should I type it at the end? If you can, go ahead and type that in for us. Healthychildren.org?
Yep.
Okay.
And if you just type that into your browser, it'll open up to the front page for that periodical. It's something that's always available. The Academy of Pediatrics has had it up and running for about 10 years. But on the very front homepage, there are several articles specifically related to COVID-19. So there's general information on the virus. There's one on social distancing. There's a great one on working and schooling from home. A section on positive parenting, because it's incredibly stressful for us all to be trapped at home and not able to get out and be with our friends and the kids with their friends. So it's stressful for the kids and it's stressful for the parents. So positive parenting. If you have a newborn, there's a specific article there for caring for newborns when we're facing this pandemic. If your child is fed with formula, there's specific instructions on how to prepare the formula to make sure that you don't get it cross-infected with COVID-19. And then there's an article specifically for helping families with children with special healthcare needs. So it's a great website. The other website is one that Mary has referenced several times tonight, and it's from the Centers for Disease Control and Prevention, so CDC. And I don't like to type in the whole long address. And so when I was going to their site a little while ago, I just typed CDC space COVID, COVID 19, and it popped right to their page on the coronavirus. And it gives you lots of information about the coronavirus, how to keep yourself safe, what symptoms to look for. It talks about testing and who is appropriate to be tested and who's not appropriate to be tested. Mary talked about the fact that we truly don't know, because we've never seen this virus before, how individuals affected by ectodermal dysplasias will do with the virus. And she mentioned something that was probably the best way to look at it. You know yourself and your health needs over your lifetime, and you know your child or children and their health needs. If you've skated by and been quite healthy and learned how to manage, temperature and skin care and the routine things that you have to manage for your ectodermal dysplasia condition, but you haven't had lots of extra visits to the doctor for respiratory infections, and you don't have any other organs that are affected adversely, then you probably have the same risk as the general population. However, we do know, as Mary mentioned, that individuals with HED have abnormal mucus in their respiratory tract and abnormal anatomy of the respiratory tract in some instances, and that you probably should assume that you have a chronic condition related to the respiratory tract. And so I would be very careful if you have to call and talk to your doctor about whether or not you should come in for a visit, that you make sure that the doctor understands that you do have what your certain type of ectodermal dysplasia is, and how that has affected you in the past, and that it's not somebody calling from the general population. And so if I had a patient calling me who had HED and had increasing cough, fever, I would definitely want to see that kid before another kid who's never had lung problems in the past. So you probably have to be on the alert to do more things to protect yourself with social isolation and frequent hand washing and all those recommendations, but also pay close attention to the symptoms. I'm sure everybody's heard them, but the main ones to be concerned about are fever, cough, difficulty breathing, and certainly if anybody had progressed to the point at home where they already had blue tinged color to their lips, or they were difficult to arouse or talking kind of nonsense, those would be emergent situations where you really need to seek healthcare. In terms of your children, the early reports have been that kids have tended not to be quite as sick as adults. There was one pretty substantial paper out of China that talked about kids overall having only about 10-15% of the kids having more moderate to severe disease, as opposed to closer to 20% in adults. But you should know that there's a breakdown in the age of the children, so that the kids who are school-age kids and adolescents might only have a 3% chance of getting sicker than other people. But kids who are younger, particularly in the first year of life, and really particularly in the first month or two of life, probably have closer to a 17% risk of moderate to severe disease. So anybody can, would have good chances that if they got the virus, that they would do well, 80% plus chance that they would not get seriously ill. But you still have to be on the lookout for signs in yourself or in your child or family members that they're acting sicker and that they need to be seen. So Mary mentioned talking to kids about this illness. So it's important that you reach out to them and don't let them just worry and worry and worry. I'd be extremely careful not to have the news on in the background 24/7, where the kids are constantly seeing kind of the yellow journalism take on the COVID virus. It's important to ask them how they're doing with it, because it's tough on them to be trapped at home too. What they've heard and where they've heard it, they may get information from their friends. They may get information from the internet, and ask them what types of questions that they have. You need to be honest with them, and so you need to know the facts that you've taken off of the CDC website or the Academy of Pediatrics website so that you can give them good information. You don't want to overly sugarcoat it, and that kids are smart and they know when their parents or anybody else is lying to them. So you want to give them honest answers, but you should point out the things that we know are positive, so that it's important to tell them that, we have people who are extremely smart scientists who are working on trying to bring an end to the epidemic and to develop treatments to make sick people better faster, and so that they know that there are positives to this. The other things that are really helpful is to actually engage the kids so that they can make choices and try to help manage their own care and potentially to help others. So Mary was talking about washing your hands and making sure that you do it for 20 seconds. And so let the younger child pick what song they want to sing while they're washing their hands. Giving them choices is so much easier. If you tell them, go wash your hands, they may want to say, I don't really want to, and get angry about it. But if you say, hey, do you want to, wash your hands to, the Rub-a-Dub-Dub song or some other song, then they have a choice between their songs, or leave it open to them. So anyhow, giving kids choices is really, really important. And letting them pick what brand of soap that you use. If you've got more than one soap that's that you trust is equally going to work, or hand sanitizer, let them make their choice. Do you want to use the green soap or do you want to use the red soap? And so if they feel like they have a choice, they're more likely to do what you want to get done. So mention that it's important that adults stay informed, through kind of a focused and periodic attention from good sources like the CDC and the Academy of Pediatrics, limiting the amount of media exposure, and enjoy, the time with the family. There are a lot of recommendations on just dealing with these stressful times of being trapped in the house. And, I pulled them off of a pediatric website. But actually, some of these recommendations are probably better handled by adults than by kids. So really important to establish a regular routine at home. The kids are, used to getting up and going to school every day and having lunch at a certain time and having gym class at a certain time. So try to establish routines at home, but they don't have to be, you know, hardcore discipline routines. You know, lighten up and let them enjoy some of the time that they're with you as well. Um, you know, having the kids reading or doing hobbies that they enjoy as breaks tend to really help them get their mind off of, you know, worrying about this particular virus and the fact that they're trapped in the house. So pushing reading and hobbies. For older kids and adults, journaling, blogging, art, music. You know, kids at all ages enjoy music, even for your baby. You know, playing music in the background is really helpful for kids. Um, Oh, and exercise is really important. So you can do it as, you know, fun things that they like to do that are outside the house, but not in groups. Or you can pretend like it's their PE class, but you should put that into your routine. Um, and then these relaxation techniques, I am not an expert at, but you can, you know, look up on the internet and self-teach some relaxation techniques that you can use yourself, and you might be able to teach the older kids. But using mindfulness, some people will do self-hypnosis and guided imagery. And then you probably need to work with a clinical psychologist, which you may have, you know, had contact with in the past, to work with cognitive behavioral therapy is another way to help to deal with the stress. Um, so this is a new virus, and we are, you know, learning about it every day. I think the terminology Mary used, I love, is that the fact that we don't know everything doesn't mean that we don't know anything. And so, yes, it's a new virus. We need to understand exactly, you know, how it's going to have effect on people, and what we can do to prevent it from reaching us, and what we can do to treat it if it does, are all things that are being worked on. I'm sure you've heard that there are several medications that they're working on, controlled trials to see if there's evidence that they will work. And the FDA has just released chloroquine and hydroxychloroquine as use for people affected by the COVID-19. And that release is with the knowledge that that there have not been adequate studies done to know that it's going to work, but that in a very sick person it may be worth a try. The other medication that there's questions about is that a physician had written an article in Lancet, which is one of the top tier medical journals, and had questioned whether or not we should be able to use ibuprofen. And it was all theoretical questions about the mechanism of attachment of the virus, and whether or not that the way ibuprofen works in your body would interfere with your body's defense mechanisms. And so both the Centers for Disease Control and the American Academy of Pediatrics have made statements that there is no evidence that ibuprofen is harmful if you have a coronavirus infection. However, if you are uncomfortable with ibuprofen, it's certainly okay to use Tylenol, and there's no expectation that the generic name for Tylenol is acetaminophen, and there's no evidence that acetaminophen would be dangerous to use in an individual who has fever or pain, or ibuprofen. So you can use either one at this stage. I'm game to try to answer any questions that might come through.
Let me just, again here, I'm trying to multitask. If you have any questions, please type them in the comments. I don't see. Okay, so Jody posted some information about how to treat dry hands. Please take a look at that because it's, you know, if your hands are dried and cracked, it's an open area that can be a source of a different infection. So let's not ask for any trouble. Let's see. Any tips for developmentally delayed kiddos? Is there, did you say there's a section on there?
Yeah, I would go to healthychildren.org, and there's a very specific section that you can click to with one click from their opening page that deals specifically with you know, helping to work with kids who have special healthcare needs.
Okay. Let's see what else we got. Am I missing anything? I don't see any other questions. I'm just looking. Sorry, it's taking me a while to get through. I have a son with ED, and which control he needs to prevent COVID-19. I have a son with ED, which he controls. Yeah, so follow the CDC, Center for Disease Control. And again, if you just type CDC in your search bar, it goes right to the Center for Disease Control. And be familiar with those recommendations. HED kids who have outgrown their asthma, are they still at higher risk?
You know, so again, you should just be cautious.
Yeah.
And if there's any evidence of increasing, you know, work of breathing harder, faster, then that would be important even without the pandemic
Right.
to seek medical help with, and certainly in conjunction with fever and new cough or increasing difficulty breathing, that you would want to seek medical help.
Yeah, we talked to our son. He's a grown man yesterday, and he's got asthma pretty bad. He's got a kind of flare up, and Tim was saying, are you doing this? Are you doing that? Doing this? So we just need to take really good care of ourselves and know ourselves really good at this time. I think I got all the questions. Do you think a child having an immune deficiency makes them more likely to have a more severe presentation or just more likely to catch it?
So I'm sorry, I didn't mention immune deficiency. I should have. So we know that some types of ectodermal dysplasias can be associated with immune deficiency. And, you know, for those individuals, you need to be extra vigilant. You might be more likely, so both, you might be more likely to acquire the infection. And if you get the infection, your body is not going to fight the infection as well as somebody with a normal immune system. And so you want to do everything that you can do to protect yourself or your child, and to you know, prevent being exposed to anybody with coronavirus. I did want to throw out that, so we are saying truthfully that this is a brand new virus, never noted before December of 2019. But there are coronaviruses that circulate every year. We have our hospital, and probably every hospital in the nation has tests now for you know, 8, 12, 16 different viruses that we test for routinely, particularly in the winter, but in the summertime too. And one of the ones that we routinely test for is a coronavirus. It's not this specific one, but we do have, you know, we do have experience with managing sick kids and sick adults with coronavirus infections too. The other thing to point out is that, you know, it may change if the pandemic continues to spread in our country, like it looks like it will. So the numbers on it will change. But up to this point, that every person who has symptoms that are compatible with coronavirus, if they were swabbed, they would only actually have a 15% chance of having coronavirus. So if you have a cough, fever, and sore throat, you have an 85% chance that it's one of those other 12 viruses that I just talked about that we test for. Some which have treatments available and some which don't. But we have management to help treat the symptoms of those. And so even if you're sick, you're more likely not to have COVID-19 than to have it.
Okay. Let's see what else. Oh, can everybody see the chats? I think they did. Locke had a comment about, I'd like to remind parents that if your child has a 504 or IEP, that the same accommodations while at school still apply. She says, for us, Caleb has been struggling with migraines, and his 504 allows for reduced screen time, so his teachers are modifying his day. So that's really good to know. Okay. I'm sorry, I just have to page through all these. Okay. So I think I got through all the questions, and I think one of the main messages is we've talked about the CDC recommendations, and we all need to follow them. And I think talking to your kids, as hard as it is for them to be home and socially isolated, oh my gosh, kids are such social beings. So, I mean, I really feel for them because they're not used to it. And so getting them out in the backyard and playing with your family, letting them have some fresh air, and really staying calm. I mean, I decided myself to turn off some of this stuff on TV. I like to listen to the news brief by the president, but I don't have little kids running around to talk to the doctors. You know, that Dr. Burke, I think it is, she's heading this whole disaster response. I mean, one thing you have to realize, and I've heard people say, well, we only have 1 or 2 cases in our state or county or whatever, so we don't need to socially isolate just yet. But what she said, if you wait, it's too late, because once it's in your community, because it's already there, it's rampant. So stick to the recommendations and stay calm. You know the recommendations and enjoy your family. I know the kids are going bonkers running around, and so it's hard. But, we'll get through this. We'll all get through this together, and we'll learn from this, and we'll be stronger next time. So stay calm. And, maybe we should do this more often. It's kind of nice to get on and just chat a little bit. So anybody have some really great ideas about what you're doing to reduce your stress or manage the kids being home, keep your sanity? I try to get some exercise, but I know that a lot of you, and I've been seeing things online, have some wonderful ideas about how to manage things. So share them with each other, and I think that's all we have for tonight. Thanks for joining us, and we'll talk soon. So take good care. Remember, wash your hands. Oh, and remember to get your nails, and it's really the friction that is so important when you wash, not just the soap. And the space in between, do a good job washing your hands and stay home. So thank you all for joining me, and have a wonderful evening and enjoy your families.